All right, good afternoon, everybody. Happy office hours. Happy fall as well. So I'm just letting a couple more folks in here and we will get started. This is being recorded as usual, and we'll have it available on our um, Health Home webpage in the near future. So hang on tight for that. And as always, if you have any questions along the way or anything you want to talk about, feel free to use the chat function and or bring it up along the way. Just want to confirm folks can see the screen okay?
Yes.
All right, thanks. And then the chat function, can you see that up and running? So it looks like we're good. All right, so we'll get rolling. So today we've got a pretty packed agenda because we didn't meet in August. So we got a bunch of things we're gonna go through, and there's policy and procedure updates as normally have, and then we have a bunch of children's updates, some touch on NetSmart, the health home audit tool for children and adults, some updates that are coming on that front. We're going to look at the CES tool, which is a new thing that DOH has put forth. So there's some information on that and what's to come. The initial appropriateness health home criteria. We'll talk a little bit about that as well. The PCS survey that's coming up in October. We'll touch quickly on the Health Home Plus rate increase. And then the Health Home Omega audit that we're going to be entering into. And then just some updates on the overall Health Home Coalition recalibration update budget proposal that was sent back in the summer, just the status on those things. So that is our flow for today, and we'll go move forward from that. And I'll kick it over to Jess to touch on policy and procedures.
Hello, good afternoon. So for today we have a couple of updates: the access to services, health home serving children, HCBS waiver, disenrollment and discharge, and then the overall health home serving children waiver and HCBS policy. Upcoming is going to be our plan of care for adults, disenrollment, consent, and qualifying conditions should be coming out within the next month. And go to the next slide, Travis. So access to services was an annual update. I just chose on this slide to talk about a couple of tweaks that we're going to be making on all of our policies moving forward. Just some compliance changes. You're going to see that our chief compliance officer has been added back on as the approver of our policies. The other thing we're going to be incorporating into all of our policies moving forward is going to be at the top. Right under our review date, you're going to see the DOH policy number that our policy is based off of, or the DOH standard that the policy is based off of. And then you probably may or may not have noticed towards the top of our policies, there were 3 bullet points. We removed number 2 and we have replaced it back in. It's going to be our acknowledgement of receipt policy. It basically states that if you have any questions regarding the policy or anything you need clarified that could potentially change the policy, that you have 10 days to inform the health home, the assistant director, myself, of any updates or questions pertaining to the policy. Not that you can't ask any questions, but this gives us a 10-day window to revise if needed based on feedback. So that's just some updates that you'll see on all of our policies from this group forward that we have updated. You can go to the next slide. No changes on the health home serving children, HCBS waiver, disenrollment, and discharge policy. So it was an annual update, so there's no policy changes. A couple of things I wanted to point out, though, is that when we are doing the notice of decision of disenrollment, the DOH 5288, that needs to be issued 1 to 2 days from the decision to disenroll. So if you document in the member's record today on 9/26 that the family would like to disenroll from the waiver, you have 1 to 2 business days to complete that 5288, issue it to the family, and then have it uploaded in the record. Um, Also, if you are disenrolling a family because the level of care came out denied, so they did not meet level of care, you have to document that the member was explained their rights to a fair hearing. So in some cases, when we do a level of care on our members, they can come out ineligible. If they're come out ineligible, they do have the right to a fair hearing and something called continuing aid, which means that if they are currently in receipt of those HCBS services, we would continue those until a decision was made on the fair hearing. So you just want to make sure two things. You're issuing the form within 1 to 2 days. And then if you're doing a level of care and the family is coming out ineligible for those services, that you're letting the family know that they do have a right to file a fair hearing. You can go to the next slide. A couple other important things. We want to make sure that we're contacting capacity management to have those K codes removed. I know that there are a lot of issues with having K codes removed. It's super important that we have notes in the record stating on this date that the health home care manager contacted capacity management. And then as I ask all of you, if you are contacting capacity management, the K codes are not being removed, please let me know, and that I will follow up with DOH myself. When it comes to disenrollment from HCBS waiver, we want to make sure that we're communicating that with the care team, the managed care company. So Fidelis, CDPHP, MVP, United Healthcare, they are also part of the care team. So that disenrollment needs to be communicated with them, and it needs to be documented that you had a conversation with the care team that the member has decided to disenroll from HCBS. And then once again, going back to the pursuit of the fair hearing, if they are found ineligible on the annual level of care, and they would like to file a fair hearing and continue with the HCBS services that they are currently receiving. So this would only be applicable to our members who come out ineligible, who are actively receiving an HCBS service. You would complete the state review node in the UAS. And that would notify DOH that the K codes will not be coming down, and that they're kind of on hold until the fair hearing results would be final. So just something to keep in mind only for those members who come out ineligible on their level of care and are actively receiving HCBS. You can go to the next slide. All right, so this is our health home serving children waiver and HCBS workflow policy. There were quite a few updates to this that were all based off of our recent HCBS audit and some of those clarification webinars that have been happening around the MEDF population and our SED population. So some of those things that came out of some recent webinars and some updated guidance from the DOH is that we want to make sure that if we're working with members, and this is for all of our members enrolled in Children's Health Home, is if any of our youth and children that we're working with are at a higher level of care. So if they're at risk for a higher level of care, so that could be RTF placement, hospitalizations, we want to make sure that we're discussing HCBS with the family. We have HCBS brochures, those parent tip sheets that are located in our HCBS toolkit, that we're discussing their options and we're offering those services if they would like to pursue those. The other thing to point out is that if you have an enrolled member who was placed on an HCBS waitlist, the health home care manager must have contact and documented contact that the member is actively waiting on that waitlist, and then note the barrier to service. So if you have a member who's been sitting on a wait list for respite and you continue to have monthly contact with whomever you sent the referral to, and they continue to report that they're on the wait list because they have a lack of providers, then you want to make sure that you're noting that every month in the member's record. When we're audited, they're going to be looking for that monthly contact. The third bullet here is going to be around the SED webinar that we all attended about clarification. So for SED, so serious emotional disturbance, a diagnosis is not enough to confirm that they actually have SED. So what we want to make sure that we're getting done is that the SED attestation form must be signed by a provider and uploaded into the record. So in order to complete a level of care or enroll a member for a single qualifying diagnosis of SED, you want to make sure that you have the diagnosis and the functional limitations together. And then that is what makes the SED determination. That attestation form is located in our qualifying conditions policy. There are some CMAs that have their own form that they have signed, and that's absolutely fine to continue using your own SED form. You do not have to use the one in AHI policy. However, that form must be present in the member's record if they are enrolling in the HCBS waiver for SED target population, or if they are enrolled under Health Home in a single qualifying condition of SED. Go to the next slide. Another thing I wanted to touch on would be the risk factors associated with the LPHA for the SED target population for HCBS. In order to proceed with completing the level of care in the UAS, you have to have the SED diagnosis. So it's going to be that SED attestation. You're going to have this LPHA form signed by an LPHA. And then they're going to mark off one of those risk factors. So if the member is currently in an out-of-home placement, you have to have documentation of that. That has to be uploaded in the record to support the risk factor. If the youth has been in an out-of-home placement within the last 6 months, you're going to need to upload that documentation to support that risk factor. If you've applied for an out-of-home placement, again, you're going to upload that documentation to support that risk factor. And number 4, if the child is multi-system involved, then you're going to want to make sure that you're uploading those documents into the member's record to support that member's risk factor. So it's going to be the SED attestation, the LPHA, and the documentation of these risk factors that are going to make you eligible to complete that level of care in the UAS for the member. Go to the next slide. So this is to clarify that Med F population. We have currently no one enrolled in the Med F population in our health home, but if you were to move someone into that target population, we got clarification for initial eligibility. You can use the 3 forms. So that's going to be the DOH 5151. That's the medical report that's completed by their doctor. You can use the 5152 if they are enrolled in school, which would be the questionnaire of school performance that's to be completed by the school. And then the 5153 activities report to be completed by the parent or guardian. These 3 forms can be used for the initial level of care only. Once you have the initial level of care, moving forward, in order to complete an annual level of care, you must have a disability certificate or you must have an SSI certification. If you do not get one of those 2 things for their annual, then they will be ineligible to have a level of care completed. Next slide. So this is going to be an upcoming form that is in NetSmart. It's going to be a required form for any of our members that are enrolled in HCBS for children's HCBS. This form here is going to allow, it's one of the elements that's going to allow our plan of care to be uploaded into MAP. So it's not live yet. It's currently in our UAT. It's not in production, but I did want to give everyone a heads up that this will be coming. It's called the Children's HCBS List of Services Assessment, and it is under additional forms. I took a little screenshot. It just lists every single HCBS service. You'd put interested, waitlisted, receiving, not interested, and you just click down the radial buttons. It's super quick and easy to fill out. Again, this will be required for anybody who's enrolled in HCBS waiver for children. And then this will allow our plan of cares to populate into MAP moving forward. Next slide. So there is a new form. It is the supervisor sign off form. This form is created and it was added to the HCBS toolkit, and it is going live for 10/1. This is a supervisor document form, sign off form, checklist form. This screenshot is only showing the top portion of this. The rest of it is a checklist form. This will need to be completed prior to the level of care being done in the UAS. So the health home care manager is going to collect the required documentation to complete an initial level of care or an annual level of care. So this will need to be completed each time. The health home care manager is going to make sure that they have the SED attestation on file. They're going to make sure that they have the LPHA on file. They're going to make sure that they have documentation of those risk factors on file. What they're going to do is they're then going to present those forms to their supervisor. Their supervisor is going to confirm that they have all three of those things and they are completed correctly. Another thing is just because we have the form, it doesn't mean that it's filled out correctly. So we have to have the supervisors verifying that the forms are done correctly. If at any time you want to have a conference based on the documentation you've gathered, you can 100% reach out to me and we can review them together. Then the supervisor is going to have to submit this form to the health home, so directly to me, where I will then review the documents and make sure that they are completed in their entirety and completed correctly. And then once I have reviewed them and assured that they are all there and they are done correctly, the health home care manager can then go in and complete either the initial or the annual level of care. Next slide. We also updated the quality and performance improvement section of our HCBS waiver policy. What we are going to be doing is we're going to be auditing the HCBS waiver chart twice a year. So right now Taylor does a spot audit. So twice a year she's looking at your consent forms, your eligibility, your care transitions. We are now also going to add an HCBS record to that twice a year. So those will be part of your comprehensive quality notebooks. We're also, as we move forward, if we have pulled records that are HCBS records, when we do your annual comprehensive chart audits, we've kind of had two forms. You have your annual case review, and then you had that HCBS audit. We have not been combining those scores into one. We've been keeping them separate and using the HCBS kind of as just informational only. Moving forward, those scores will be combined into your overall scoring on your comprehensive chart audits. And the reason that we are doing that is moving forward for redesignation, our HCBS scores that we as a health home receive will now be factored into our redesignation scores as well. And then our HCBS audit tool has been updated based off of our last HCBS audit. And go to the next slide. Does anybody have any questions on policy and procedure that I just went over?
Yes, I just wanted to note to folks, a lot of these changes are coming as a result of the HCBS audits that we just went through and some of the recurring trends. And as a result, as Jessica just indicated, that it's going to be wrapped into our redesignation as a lead health home moving forward. We have to tighten up our process and working with you to make sure that we're hitting those areas that we have not been performing well in.
Yes, that is correct. So a lot of this was as a result of our audit that we just went through. And then it's also because we have received an updated redesignation policy from DOH. So we have also had to move forward with updating some of our own internal policy and processes. So that's the why behind some of these changes. Moving
Jessica?
forward, you're still, go ahead.
Hi, it's Angela. Just want to go backwards for just 1 second because I was taking notes while you were writing, but where is that SED attestation form on? It's on the AHI website?
It's on the AHA website in our qualifying conditions policy, and it's
Okay.
also, I believe, number 1 in your HCBS toolkit.
Okay, thank you.
You're welcome. So you're still stuck with me. Moving on with general children's updates. CANS 2.0, we're still waiting to hear from the state on trainings and updates to that. Nothing has been released. They're supposed to be offering trainings. They have been updating the algorithm behind the CANs. I have no further information, but I just wanted to keep it on everyone's radar to keep an eye out for updated information coming through and training offerings on that. Secondly, I did send out an email that our safety and crisis plan in NetSmart is working.
Yahoo!
Yeah, finally, if anyone has any issues with the safety and crisis plan as they go to do it in NetSmart, please report it to me. NetSmart did ask about it on the last call if we're having any issues. I had nothing to report to him, so I assume everything is working smoothly. So I do ask that everybody go in and make sure that they have an active safety and crisis plan. So one that's been completed in the last 12 months. If you have one sitting in draft because you couldn't finalize it, you should be able to now. And then for all of our supervisors and care managers, you can pop into DataDen and you can go look at that safety and crisis plan assessment in DataDen, and it'll tell you who on your case list does not have a safety and crisis plan. So you can go ahead and see who's missing one, who has one. If it's in draft, it's going to show that it's missing. So you can go ahead and look back at your caseload to make sure those are all completed.
We did.
Um,
Jess, I just wanted to note too that, as number one, we apologize that it's been such a long time that before this got corrected with NetSmart, we were with them and on them about it for quite some time. And it did come
About
up
a
in
year and
our,
a half.
yeah, it came up in our audit review as well for HCBS as part of our reply back, because that was a deficient area. And we noted the fact that our HR vendor, was tardy in getting this done. So we realized it was out of your control, meaning those who were trying to do the work and couldn't because this wasn't up and running. And we've noted that, and, but we have to, as we move forward, get it cleaned up, unfortunately.
Thanks, Travis. And I really encourage everyone to use that DataDen report because that'll really show you who is missing one and who needs one completed. And a lot of them are sitting in draft because they couldn't be finalized. You can now go in and go ahead and finalize them. Our third bullet here, I'm sure you have all seen some invites coming out with me as part of our response to our recent HCBS audit. We will be hosting quarterly HCBS workflow trainings and quarterly HCBS plan of care trainings moving forward. So I've scheduled those to start Q4 of this year, and then moving forward, once a quarter, I'll be offering those trainings, and it could be refresher trainings for anyone who wants to join. If you have new staff coming on, they're optional. They may not be optional moving forward. If we have a CMA on a corrective action plan, it may be required that staff attend, but for right now, it's just optional and informational to keep that on the top of everyone's mind because not everyone's doing the HCBS workflow all the time. And then once again, just to reiterate that we have updated our HCBS audit tool, and that was based off of the HCBS audit that we received and the questions that were in that specific audit. Next slide. So here's that attestation form that I touched on earlier. So if you have a member that's enrolled in Health Home under a single qualifying condition of SED, you need that noted in the eligibility assessment in NetSmart because that's also going to move into the children's billing questionnaire, and that SED attestation is required. If when you're doing the eligibility assessment in NetSmart and you note that they're enrolled under a single qualifying condition, that connects to the children's billing questionnaire. When we're audited, the state will come in with a list of members that they're auditing and what category we're billing under. So if we're billing under that member having SED, meanwhile, they could be eligible for Health Home because, they have a mental health diagnosis and a physical health diagnosis, but we're billing under that single qualifying diagnosis, they're going to want to see that attestation in the record. And then I said earlier for the HCBS youth, if we have youth that are enrolled in the SED target population, we have to have an SED attestation noting that they have the diagnosis and those functional limitations associated with it. And then this is also an annual form. So not only is it annual, every year you go to do your annual level of care for our SED target population for our HCBS youth, it's also an annual form if you have a member enrolled in a single qualifying condition of SED. So I just also wanted to compile a couple slides on common themes and feedback that we saw on our HCBS audit from the state. We did get member level detail this time, so I have sent that out to everybody. Everyone's supervisor has received an Excel file that had all of the charts pulled, and it had whether the documentation was present, missing. So I did send that out to all the supervisors. I have also individually gone through each one of those records and verified if it said it was missing. Is it really missing? Did I find documentation that they said that was missing but is actually there? I did send that to the Department of Health to relook at some of those things because it is noted places that there's some documentation missing and it's actually present in the record. I have not received a response on that. I did receive some clarification on some questions I sent in, so they are looking at that. But I just wanted to go over some overall themes that we saw in that, which could also carry over into our children's redesignation that would be coming up, I believe in March. So the first thing would be our DOH forms. This is going to go for the entire health home. Anytime you're completing a DOH form, so whether it be a consent form, a 5234 form, you want to make sure that when you're filling out a DOH form that it's completed in its entirety. That means every date line has a date on it. Every signature line has a signature on it. If you have to check a box, you're checking the box. What we have discovered is if there is one piece of information missing on one DOH form, they count the entire form as not being present in the record. So this is super important for the entire health home, anytime we're filling out any type of DOH form, to make sure that it's completed in its entirety. And if there's more than one page to it, it's completely uploaded in its entirety. We just reviewed those SED attestation forms. Again, those are in our qualifying conditions policy. You can use those, or if your CMA has one of those forms that they use internally, that is acceptable as well. The other thing we were looking at was our LPHA forms not being completed correctly. So that's going to be part of that supervisor checklist and sign-off form going forward. It's great that we're getting our LPHA forms back and uploaded, but they're not being completed correctly by the provider. So that's one of those things that we're going to have to verify before we proceed with that level of care, is to make sure that that LPHA form is being completed correctly. The number one error on those LPHA forms is the provider is listing a primary diagnosis that is not an SED eligible diagnosis. So we're seeing a lot of developmental diagnoses listed as that primary problem, which is not an SED diagnosis. So you just want to make sure that you're double checking to make sure your LPHA has completed those forms correctly. The other thing that was noted on our audit was monthly communication between HCBS providers and the health home care manager. So if you have a member who is waitlisted for service or is actively receiving service, you want to make sure that in your record, you are having monthly communication with that provider or that provider that has your member waitlisted. We want to be careful when we're documenting, and I know this is super meticulous, but you want to make sure that your note states that health home care manager contacted Sam at Northern Rivers. That's great. I love that you contacted Sam. We want to be really clear that we know who Sam is and what role she plays at Northern Rivers, because is that the counselor at Northern Rivers or is that their respite provider for HCBS at Northern Rivers? If it's not super clear in that note, we run the risk of not getting credit for having those communications because it's not clear who we are speaking with. So you want to make sure that when you're writing your notes, you want to make sure that you're putting in there who the person is that you're speaking with, where they're from, and if they're providing a service, you can put their HCBS provider, their planned respite provider, whatever, however you want to note it to make it clear. This goes for the whole health home, not just our HCBS kiddos but we want to make sure that we're having signatures on our plan of care. For HCBS, signatures are required on the plan of care. If it's missing a signature, if your amendment, if you had 4 amendments in a year and 1 amendment is missing a signature, you get 0 credit for all of those amendments. So you want to make sure that they all have signatures on them. And we also want to make sure that if the youth is 10 or older on our HCBS plan of care, is that the youth is also signing the plan of care. It is required for HCBS youth 10 and over to be signing off on their plan of care. For our mainstream health home members, it is not a requirement. However, we will be auditing and looking for it just to make it a standard. That was one of the clarifying questions that I had out to DOH, and they did clarify it is 10 and older.
Jess, there's a question. Jess?
Yeah.
Sorry to interrupt your flow. I know you're on a roll right now.
That's okay. It's a lot of talking. Please talk.
I know. There's a question that came through on the chat, though. We just want to seeking clarification. If a person has an AOT court order and they refuse to sign or participate in any forms or any assessments, the document in the chart, and self-sign as AOT, refuse to sign. Is that appropriate? Is that correct?
Yes, that would be sufficient. If we were in an audit, this has come up before, and I don't think we have ever been dinged on an audit for an AOT member refusing to sign anything. And I know it's come up with consent forms and it's never been an issue. We just document that they are an AOT member and they refuse to sign. So I would assume that would go for all documents, and you can note that, you can type it right in on the plan of care as well.
Yeah, I would say better safe than sorry, right? Show your effort in the response. Thank you, Jess.
Yep. Where did I leave off? Oh, our HCBS youth, you're going to see, I'm sure you saw when I sent out your HCBS individual results, our youth not receiving their monthly face-to-face visits. One thing that they were auditing for and that they did not take into account was during this time period, we were under the public health emergency where you could waive that face-to-face if there was a COVID concern. That was not taken into consideration. So if you were serving a medium acuity youth, that medium acuity youth needed a face-to-face that month, regardless of the PHE. This is one of the things that I did put in our corrective response back to them in our corrective action plan. So I did raise that to them. I have not received a response. So if you do see that on your individual scores that went out, that is what they are referring to. The other thing that was missing from the record is sending our plan of cares to the MCOs. Hopefully this will be going away because as soon as our plans of care are being uploaded into MAP by the health home, the MCOs will be able to go in directly into MAP and look at those plans of care. Again, this is one of those things that is super hard to audit because it has to be explicitly written in a note that on this day, you send the HCBS plan of care to Fidelis. It has to be explicitly clear in a note for an auditor to see, read, and for us to get credit for. Something that we touched base on earlier, again, was our safety and crisis plans. Again, it took 1.5 years and we apologize greatly. It was 1.5 years going back and forth with NetSmart to have this form built and then work properly. And then to accompany that, one thing that we want to make sure is that anytime we're working with a member where there is a safety concern noted, we want to make sure that those safety issues are part of our plans of care and that we're communicating them with our care teams. So if that member has a care team that is involved with that member in some capacity that could support a safety concern in the home, we want to make sure that we are communicating with those providers and we have it directly embedded in our plan of care. So that could be whether that you review the safety and crisis plan with the member monthly, you note the specific safety concern in the safety and crisis plan, that safety concern directly in the plan of care. It's going to be different for each kid, but we want to make sure that the safety and crisis plan isn't something that we just do and then we leave it for a year. It has to be incorporated into the plan of care for these youth. And as best practice, it should be for all of our youth. Next slide. Only a couple more things, I promise. Disenrollment from HCBS needs to be communicated with the whole care team, including the MCO. Again, that's going to be done through a note. That's where you would need to note to put this into writing is that so-and-so is disenrolling from HCBS. Here's the reason. The care team is notified, whoever makes up that care team. You want to make sure that it's including the MCO if they have an MCO and they're not fee for service. The other thing is our level of cares are 365 days. They're not being completed on time. The CANS assessment is a little confusing because it goes by the month. The level of care is to the actual date. So if I was due, say my LOC expired 9/26/2023, I don't have until the last day of September to do my level of care like I would the CANS. I have until yesterday to make sure that my level of care is done. So we really want to be aware of those level of cares when they're due to the date. I have been trying to email people 60 days in advance of them having an upcoming plan of care due. This way you have time to start collecting all that documentation, verifying that it's completed correctly to make sure that we can get those plans of care or those levels of care completed in the 365 days. Our HCBS plans of care, those need to be done within 30 days of the level of care. You complete a level of care today, you have 30 days to get an HCBS plan of care done. If you have a CS youth that you have enrolled from the date of enrollment, you have 30 days because they're coming to you with an active level of care. So you want to make sure that you are getting that HCBS plan of care completed as soon as possible. 30 days is an extremely short timeline to work with. So it can be a pretty basic HCBS plan of care. It doesn't have to have much in it. Then in 60 days, you would go ahead and then do the full comprehensive plan of care. Personally, I just do one and done and get it all done within 30 days, but I do understand that that turnaround time of 30 days is very difficult to adhere to. Lastly, frequency, scope, and duration. If you have a member who is receiving an HCBS service, you have to make sure that frequency, scope, and duration is in the plan of care, and that's coming to you from the HCBS Health Home Care Manager authorization form. There is a very specific DOH form that provider has to send to you that has frequency, scope, and duration on it, so you can put it in the plan of care. You're not responsible for that form, but you are responsible for making sure frequency, scope, and duration is included in the plan of care. This is one of the things that hopefully will kind of go away once our plans of care are in MAP, because what's going to happen is that authorization form at some point will be electronic, and it will be that frequency, scope, and duration will be readily available to everybody. And then the plans of care will be automatically uploaded into MAP every time there's an initial or an amendment. But for now, it is a manual process that is on the care managers to make sure that is completed. And then as always, if it's not documented, it didn't happen. So a lot of these things are captured in notes that you contacted capacity management, you communicated disenrollment with the care team, you communicated monthly with a provider. I understand that a lot of these things are just embedded in notes. And when we're noting it, we just want to make sure that we're super clear on the HCBS tasks that we are performing. So it's easy as an auditor who's reading, 60 pages of notes to kind of pull out keywords to make sure that we are getting the credit for the work that we're doing. And I think that's it for this slide, Travis.
Thank you, Jess. I know that was a marathon that you went through, and if folks have questions now, absolutely, let's talk through. And if not, you know where we're at, reach out. We're more than happy to talk through them some more. We have this slide deck as a reference that'll be sent out after office hours, just for people to touch back on some of the themes. And also it's on the recording, which will be on the website. So there's some different areas that you can get this information again if you want to refresh on it or don't quite have clarity, and we can definitely help with that. The reason Jess went through so much detail is because there was a lot of things that were identified in our HCBS audit that we have to correct moving forward. So hence the checklist that would be signed off by the supervisor and then by the health home, because we want to minimize some of those themes from happening moving forward, especially since it's going to be part of a redesignation for health homes as they go through their next reviews. So is there any other questions or thoughts or comments around anything Jess went over? I know she went over a ton. A lot came out in the last 30 days, since, we got out of the summer months into the fall here. All right. Well, we'll keep moving forward then.
My slide again. I just get to keep going. So I touched on this earlier. It's that new form that's going to be in NetSmart. It's going to be under the additional forms list. So it actually pertains to children and to adults. So this is going to pertain to any of our kids who are actively enrolled in HCBS. You're going to click this very simple form that shows interested, waitlist, receiving, no interest. And it's going to be for our adult members who are HARP and receiving HCBS. So if you have an adult member who is HARP and not receiving HCBS, you do not need to complete this. This is going to be required only for our actively enrolled HCBS youth and our active HARP members in receipt of HCBS services. If they are receiving core services, you do not have to complete this. Again, these pictures were captured out of our UAT environment. This is not live in our NetSmart environment yet. As soon as it is pushed to production, we will let everybody know. I just wanted to give everyone a heads up that these 2 additional forms are coming out. And again, the theory and the necessity behind these forms is we need these 2 pieces of information in order to complete that plan of care upload into MAP. So our plans of care currently, how they're built in NetSmart, do not capture these pieces of information. So NetSmart had to create these 2 forms in order to complete a full plan of care that would upload into MAP and meet those specs that we have to meet for a complete upload. So we will send out communication when this is in production and we're ready to move forward, but this is just kind of a heads up that it is something that's coming. I did put it in our HCBS waiver policy. I will be updating our HARP policy to now include these 2 forms in your workflow. Does anyone have any questions on this? Okay, next slide.
All right.
Oh, look, it's me again.
Let's say, did you want me to take this or you want it?
I'll do it. I'm on a roll.
Okay.
So we just wanted to send again an FYI out there. We have updated our audit forms for both adults and children. So not only did we update our HCBS audit tool for children, we have completely overhauled our comprehensive annual audit form for adults and children. These were based on our new health home redesignation audit tool that was released in August. In August, we got a new redesignation policy and we got a new tool. So when we are audited next, which is going to be, I believe, in March of 2024, This is a form that they will be using when they audit us. So we have updated our forms to include those questions that are now on the new redesignation tool. We have not published them yet. They just got out of their draft form. We will be publishing them within the next, I don't know, 30 to 60 days. We just wanted to make sure that the tool was complete. So we're going to test it out. And then once that's done, we'll let the network know, and we're going to go ahead and put them up on the website and take down the old forms. And then also, like we touched on earlier, that a lot of our updates are based off of our HCBS policy audit that we just had done. But there are also a lot of updates on a lot of those policies and our processes and audits, because we have also received an updated quality and performance improvement policy from the Department of Health. So the redesignation process was updated, the tool was updated, and then they updated their quality policy in August. So we're going to be updating our tools. Those will be coming out. And then also our quality policy will also be updated to kind of reflect the new process that the DOH is doing.
Yeah, we're
So-
trying to
Go ahead.
mirror. I was just going to say, we're trying to mirror as much as, practically possible the outline that DOH is putting forward, so that we're consistent. And then you are as well, if you're choosing to use these tools to do your own internal audits and reviews, that it's all flowing consistently and there's no surprises. All right, Jess, so thank you again.
Right, hopefully that's my last slide.
Yeah.
It is. All right, I'm out.
Anything from anyone before we move on to the next topic, the CES tool? Okay, so here we are. Department of Health, I think it was September 16th, notified the health homes that the CES tool was finally coming out of draft. This tool is the Continued Eligibility for Services tool, CES tool. It's specific to the adult program, so this does not apply to children's. This is an effort to capture eligibility for members in the adult program through an assessment that is done. And I'll get into those timelines in a moment. And the idea is to, really hone in on who's eligible for health home for the adult program, and who needs to be moving towards a discharge or a graduation from the program based on their eligibility criteria. So that's an attempt at the budget recalibration effort. As part of the savings that's going to be moving forward effective October 1 and following. So this is that first step on all that discussion around that $30 million fiscal year budget savings. So this tool, the DOH just plopped it upon us. I'll be sending out the PDF and the Excel format of that, along with the office hours slide deck after we meet today, along with a link to the DOH website where these tools are located in PDF and Excel format as well. The other thing is you'll be getting notification of upcoming training sessions for registration. The dates are right here. DOH is pushing this training out statewide. It is going to be highly encouraged that there's attendance to this because it's going to impact workflow moving forward. So it should be happening. This note here came out Friday, so this should be happening this week, hopefully, where those registration dates and times should be coming up for folks. It'll be 3 separate sessions offered. I don't believe we need to attend all 3. It's one of the 3 to go through how to complete this tool and what the rationale is behind it. This is an example of the template, which I'll send out to everybody so you can see. Again, it's for the adult program only. And it really breaks it down. Any member that's eligible for it should not be completed for anybody who's eligible for Health Home Plus currently. But there's a set of criteria that are asked. There's a pre-screen section, and you can see, I'm not going to get into verbatim. You can look at the tool when you receive it. I also don't want to misspeak because the training's coming up and I want you to hear it right from DOH, not from me initially, on what the expectations are around this tool. But there is a basic pre-screen section which goes on to a significant risk factor section on this next slide. And there's some selection criterion that the care manager would have to choose from when they're completing this tool, and a free text box as well to add content if they feel they need to in reference to the risk factor or for risk factors. There's additional questions in the next section around risk factors in general. There's a stability risk factor section and a skills-based risk factor section. As you can see, there's yes, no answers. And what ultimately this tool will do once completed, from my understanding, is it'll tally through some formulation to identify whether that person is eligible or no longer eligible for Health Home. There's an engagement piece as well. Again, I stress that this will be gone through in detail at the training that will be provided in October by DOH, and then what the recommendations are and comments for free text for that as well. The next steps, we've got this tool, I told you, in September on the 16th. The notification for the trainings will be coming out. It'll be a 90-minute training session statewide out of 3 sessions to choose from. November, CMAs are to start to use the tool, either integrated in EHR or a standalone Excel tool. So that's why I'm supplying the Excel tool as well for reference. We are working with our EHR. This is not just NetSmart for AHI Health Home. This is all NetSmart Health Home providers that are with NetSmart, as well as all Foothold providers, which is with Foothold is an electronic health record. It's statewide. So there's a lot of pressure on the EHRs to get this template uploaded in their systems. We're being told by NetSmart that it will be done. So that is the intention. But in the event it's not, the state is expecting CMAs and leads to ensure that the tool is done manually, which would be a whole nother process if that ends up being the case. So December would be go time. You start using it in November, and in December would be starting to be outcomes being submitted through to the state, and reporting starting to occur that way. And as time goes on, that eligibility status will start to show through data, and the state will be able to see this tool and function and address accordingly. That is all I have at the moment for the CES tool. I just want to make sure you have it, you can see it, take some time to look at it, knowing that the training's coming up in October to really get the direction from the state on how they want it completed. The Health Home lead will be on one of those trainings as well. So we're hearing the same thing just along the same time as you all are. And the idea for this, once it's up and running, it's for any new members that are enrolled after 11/1 of 23. And then it would be completed every 12 months post-enrollment, and then every 6 months thereafter. For existing members, as of 11/1/23, it's going to be at the time of their next reassessment. I'm not quite sure what the Sound Simple But bullet is there, but that was included on the slide deck that I pulled this excerpt from. But that is where the timeline falls currently that the state has put forth. We are fully understanding and aware that this is extremely aggressive. There was a lot of talk, a lot of waiting, and now here it is happening. There has been a lot of pushback from the New York State Health Home Coalition, which the AHI Health Home is a part of, about the rapid fire that this is coming out, along with some other things that is happening on state level being pushed out. And, the Health Home Coalition has reached out to the state in writing about this and is requesting a meeting to talk further about some of the short timelines that are in place. What that's going to bear as far as result, I don't know at this point, but I just wanted you all to be aware that that is a step that the coalition has taken in response to this piece of push for the rollout. Is there any questions initially around this continued eligibility screen tool? Okay. So that's what we have. More to come in the training. So stay on the lookout for those dates and registration. Another piece of that training is going to be the initial appropriateness need reporting. Now, appropriateness criterion has already been a part of policy and part of Health Home for a significant time frame. We already track that through our eligibility assessment in NetSmart. That has to be completed when a person's enrolling into the program. So we're hitting a lot of the marks on this already. So for us as a lead, as a network, this training is that's going to come up in October along with the CES tool is going to define further what the state's looking for eligibility, appropriate initial appropriateness criterion. And there's going to be an expansion around that. It's really going to come down for our CMAs and that we're documenting appropriately in the record along with this eligibility assessment tool that we're completing. So, as far as the clarification around that goes, that will be really, from our viewpoint, currently as a lead, the only change that we'd really have to focus on, unless there's something that comes out in these trainings in October around it that's going to exacerbate that. But it really be around how we're documenting in our notes the appropriateness criterion. The intent of this is to look at the reduced enrollment of folks who are not appropriate. So we've got the CES tool around eligibility and this appropriateness criterion to meet Health Home outside of the eligibility itself. There's a little bit of the why behind it from the state. Again, they'll get more into it on the training in October, but it's really to look at how it's being recorded through required policy, how it's going to be reported to DOH, which will be clarified in those trainings, how that data is going to be collected. We already submit that through our EHR, so that shouldn't be a factor for our Health Home. And then how that's going to ease the process of determining appropriateness for care management staff. This is supposed to do that to reduce inappropriate enrollments. So there's a big look at that. And this is another factor of catching some of that cost savings that was coming out of the budget cut that came through for Health Homes. That's going into effect as of 10/1 of this year, that $30 million number statewide. So this CES tool and the appropriateness need reporting are areas that are being focused on by the Department of Health to help in that cost savings effort. Any questions around the appropriateness need reporting piece at the moment? Just some
Travis, there
highlights.
was a question in the chat box.
Yes. What was
Tom
it?
is asking, will the initial eligibility assessment we already complete still be required? The answer to that is hopefully yes. What we're hoping to do is work with NetSmart to have that eligibility screening that we already do in NetSmart be the eligibility screen and appropriateness criteria for this. So we're hoping just to build off of that. It's something you guys already do. It's already in your workflow. You can already report on it into DataDen. So that would be the easiest thing to do moving forward. So that is what we've spoken to NetSmart about.
Yes, and as I mentioned, thank you, Jess, and good question, Tom. As I mentioned a little bit ago, we already have it as part of our workflow process. So if NetSmart can just do some toggle drop downs tied to that assessment that's there already, it's not going to change our workflow any. It's not going to be an additional step. Maybe a couple toggle hits, but it's better than going on to a whole separate form, a whole separate spot to do work for entry. So that's our intention, to keep it simple. This does impact adults and children. Initially, this discussion was around children's program. And this was one of the things that was rapidly brought forth in the last month, that it's also adults as well. So now this is pertaining to adults and children. So once this training occurs, there's a go live target of December 1st of this year for this initial appropriateness criterion component. Is there any other questions or comments or thoughts around this? Again, if you can hit one of those trainings, please attend. You can hear it from the horse's mouth, if you will. The PCS survey, I've had this up a few times. I know we didn't meet last month. So a lot of stuff was pending as far as what was going through today. This is coming up quickly for the especially mental health providers. This is the Health Home Plus providers. It's the week of October 23rd through 29th. Each CMA, who's a specialty mental health provider, should have been notified through their security manager to identify a coordinator for this, a survey coordinator, and getting access. So if you haven't heard from your security manager, you may want to reach out to them supervisor-wise to connect on this. There were trainings that just occurred along this topic as well that went more into detail on it. A clarification question that I did reach out to OMH on because I was getting a lot of feedback that there was inconsistency on who this entailed. Was it all of folks that were part of the CMA? Was it adults and children? Was it only Health Home Plus folks? And the answer is right here. It's everybody who's on the 0780 code, which is the Health Home Plus Specialty Mental Health code through OMH. And it is specific only to those Health Home Plus SMI adults. So it's not going to be for children. And the other thing that was clarified is it does not apply to Health Home Plus HIV members. So I hope that helps answer some of that confusion. We had some lead staff attend one of those sessions, and they confirmed that it was confusing as far as message. So I reached out directly to OMH through the specialty mental health unit, and this was the response that came back. Is that helpful for folks? So we want to make sure that we're getting that survey done during that date timeframe in October. I think it's once every 2 years, if I remember correctly, that this would occur. So it's not an annual thing, thankfully. So. And then another good piece of news, we just had our entrance conference today, actually. The Office of Medicaid Inspector General for New York State has reached out to AHI Health Home, and we are being audited for the period for all billable claims from October 1st of 2017 through June 30th of 2019. The audit is going to consist of 100 randomly selected claims. And this is the type of stuff that we're going to be required to provide. We met with the team earlier today from OMEG. They were nice and they came up from Albany. We met in person, talked through some of what was expected. They're going to be looking for the complete patient record for the SIN numbers have been selected for this time frame out of the 100. Anything tied to Medicaid third-party health insurance, all account receivable transaction ledger, billing and collection procedures, all staff members involved in the person's care in that time frame. So if that person's SIN number, so for those of you who weren't in Health Home at that time that's being audited, they're looking for the staff names that work directly with the member at that time if their SIN was selected. And so there may be situation. We were with GSI through the majority, which was our electronic health record of that time frame. I think it was about a month roughly that we were in NetSmart. So we're between two electronic health record platforms where we have our data. So we're digging in and out and starting to dig in. We did get our list of 25 out of the 100 SINs yesterday. So we're starting to dig into things. This will be a nice little process where they're going to be our close friends for a little while. We're looking like we're going to be communicating for a number of months as we go through this and records and sending things in and going back and forth with OMEG. The lead may reach out at some point to an organization, to the supervisor, if there's a certain question or we're trying to get clarification on something. So don't be shocked if we do reach out. A good part of this should be electronic, but you never know. We may have to chase down a paper document potentially. But yeah, good times. So that is happening. The budget recalibration, I just wanted to pull this up. I know the coalition sent that in. Some of this we already went through, but just updates on the 4 recommendation areas. So the CES tool is that first recommendation. That's coming. We're going to have the training in October. The rate code for step down, there's still no further information on that, but we did get clarification through DOH, through the Department of Health Director for Health Home, Hillel Hirschman, that the community health worker role concept is going to be wrapped and tied to Health Home. So now what does that mean? Well, we're waiting to hear back from them. We just got confirmation it is going to be tied to it and in some fashion. So that would mean reimbursement rate. How does that look? So that's all being discussed through Department of Health currently and what that payment model will look like. And we should be getting more information on that. So stay tuned on that. But you'll start to hear community health worker thrown around a bit more as we move forward and is linked to Health Home program. And then the 1115 waiver, I've got the 115 waiver typo. Sorry about that. There's still discussion. That waiver's not approved yet. We're anticipating any time. New York State was hearing rumors that we may hear something in October. Hopefully that's the case. And Health Homes is definitely a topic that's been pushed on that. So we're hopeful that that is going to have a tie to the waiver as well. And that would be the updates as far as that coalition recalibration recommendation document that was sent in. I want to say the very beginning of August to the Department of Health. Is there anything anybody wanted to talk through or had questions on in regards to this? Okay. And then I just wanted to note lastly that Hamilton County Community Services had made a decision that they were going to no longer be a provider in our Health Home network. So I just wanted to note that so that folks are aware if you haven't been made aware yet. The members that they were working with were either transferred to another organization or chose to disenroll from Health Home. So all of that at this point has been resolved as far as member and engagement and where they would be going if they wish to continue with Health Home. And, as we move forward, we still have some other organizations that we're working with, 2 that are not listed here that we're talking to right now about the potential of becoming a provider in our network. And one would be specific to Warren County and the other would be specific to Saratoga County. And we'll have more information once they move forward with full contract execution and the state has identified acceptance for that. And then we'll give you more update. Outside of that, though, People USA and St. Joseph Rehab are still pending. And that's where we're at as far as our CMA network. And that's all I had. Anybody have anything they want to talk about or any questions that we didn't touch on today or wanted to expand on anything that we did touch on? All right. Well, thank you for bearing with us. It was a long one. I hope you all have a nice fall and we'll talk with you next month. And thank you as always for everything that you do. Take care, everybody.